gently. Now this is how the British talk. That's how she's talking now. So we would need Anabel to please raise it up, pop up the volume, pop up the volume. Hey, gorgeous people. Welcome to my channel, Being a Carer with Moi Kes. I remember telling you guys that there are other career progression paths you can pursue. And today in the house, I've got me Anabel. She's a carer, or whenever she wants to be a carer, she's a carer. She's also a health food practitioner. And trust me, she has a whole lot of experience. And she will be sharing with us, how her experience has been for being a carer to owning her own business. Okay, now on my channel I have 2 videos where I talk about other career progression paths you can pursue. So now you know this is a new one, health food practitioner. She will tell us what that is all about. And of course, don't forget I had a video with a friend of mine, Cynthia, where we talked about from carer to entrepreneur. All right, so this video, trust me, is a must watch. My name is Kesiena Akwara Ati, a health and social care trainer. To all you old and new returning subscribers who keep coming back to watch, love my videos, or should I say like? All right, thank you all so much. A million kisses to you all. And if you're just watching this channel for the first time, what are you still waiting for? Smash the subscribe button, yeah? Give me a thumbs up, like the video, and don't forget to click on that all important notification bell. So whenever I upload a new video, you will be among the very first to know. Follow me on Instagram, Care by Cares, TikTok and Twitter, Care by Cares as well. And I will, as always, I'll see you there. So let's not take too much of our time today. Let's dive into it. Let's get the lovely Anabel to talk to us. Yeah? So Anabel, the floor is open. Drum roll. Boom, 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 boom. There you go.
Hi, my name is Anabel. I'm originally from Uganda and I've been in the UK for 23 years. Yeah.
She's shy. She's talking so gently. Now this is how the British talk. That's how she's talking now. So we would need Anabel to please raise it up, pop up the volume, pop up the volume.
Hi, my name is Anabel Kiboka. I'm originally from Uganda. I've lived in this country for 23 years and I've always worked in care. I've tried to go into retail, but I decided in the end to go into care because I managed to work around my young family at that time when my kids were growing up. I've worked in all sectors of care. I've worked in nursing homes, I've worked in hospitals, I've worked in residential homes, I've worked in rehabilitation, and then I went on to train as a psychotherapist, which I'm doing as part of my work. And another job I've been doing for the past 15 years is I'm an emergency mobile responder, whereby in case you need a doctor or you've had a fall, I'm one of those people. If you press the button, I'll turn up. So I work hand in hand with the doctors and the paramedics as well. So that is all in care. I've also been a care supervisor, then I moved on to be a care coordinator, then a deputy manager. I was hoping to become a manager, but then during the lockdown, while I was working from home as a care coordinator, deputy manager, a thought came to my mind that I needed to work for myself.
Wow.
And then I needed something that would not stress me, because being a manager, care manager, is very demanding because you're in charge of people's lives and everything falls on you. And if you have a family, it gets to be very hard because you have your family to prioritize as well, as well as the clients.
Yeah.
So you have to have a balance. So I looked up I thought about going into nursing, but I was aware that nursing is not easy because I've come across nurses in my work and they work harder than anybody, and I really hope people appreciate them.
I do, I hope so too.
Even carers work very hard, but nurses work times 10. Yeah, so I decided to become a health food practitioner. Health food practitioner is like a cropadist. So, and that's
what did you say?
It's like a crocodist.
Acropodist.
Crocodist.
Crocodist.
Yeah. Crocodist.
Okay.
Yeah.
Another one added to the list.
Yeah. So you help people trim the nails, and being in this health sector, you're aware that many people, especially the vulnerable people, they can't do that for themselves anymore.
No.
Because due to their health or
Mm.
their movement, their mobility, so that's a service they need. So I wanted to be one of those people who would help them. So I went on to do that training. I passed the course and I did my practical training. Straight after, I opened up my business known as Flexy Food Plus.
Okay. Now, her business, I'm going to leave it in the description below. Flexy Food Plus. And the number you can contact, okay? She's willing to work the whole of Surrey, isn't it?
I cover the whole of Surrey.
Beautiful.
And at the moment,
Shy lady,
at
camera.
The moment, I have about 9 nursing homes, and
Okay.
I have private clients, and I have about 175 clients at the moment.
Wow, that's a big one.
So I've been gradually building it up at my own pace, and I think it works out better to do it and look after my family as well, while being a psychotherapist and a mobile response at the same time. So it's giving me a work balance, and I do it at my own pace, and I believe most of my clients are happy because I've managed to retain most of them.
Over 2 years.
Over 2 years.
Wow.
For those who are still with us, but as you're aware, in this, some people still and some people leave us. So yeah, and I'm happy.
You're happy.
And I'm hoping to build it more.
Beautiful.
Yeah.
Do you have any other aspirations that you want to achieve or attain?
My aspirations is still in care. I hope to provide support or help to unregulated clients.
Okay.
By that kind of help, I mean like in case, because like same thing like we do in care, like you help them with the shopping, with the tidying up, with the gardening, and driving them to health appointments. Anything that's not really restricted to medication or that's required by the CQC. So that's the kind of help I would like to do in the future, and I hope to do that around what I'm doing now.
Beautiful. So does that include companionship as well?
Includes companionship as well.
Okay.
Yeah.
Wow, you have a lot of planned up. And maybe possibly, hello guys, she could be, getting a license to sponsor. You never know when the business picks up. You know what I mean? So never say never. Is that the word?
Yeah.
Okay?
Yeah.
Never say never. So like I said earlier, I will be leaving her company name in the description below and her phone number. And she is willing to cover the whole of Surrey. And Surrey has how many counties? Do you know?
Quite a few. I'm not aware.
Quite a few, but it extends all the way to Guildford, isn't it?
Yeah.
Yeah. And Ready or Radio?
Ready. I'm not
Red
sure
Hill.
even Docking because I have a few clients in Docking as well.
Okay.
Yeah.
Okay. So if you're watching this and you have a care home, or you know someone who owns a care home, or you know someone whose parents or grandparents need some to cut their nails and all of that, this is the person to go to. And like I said, watch this space. I'm sure she's going to have a license sometime when this aspiration that she has to offer companionship, shopping, appointments to people, and all of that comes to pass. We will be here again with her. Okay. So any last words for everybody, to carers out there who are thinking of starting something but are not sure what they should do?
What I'd like to say to fellow carers out there, being a carer, I know it's not easy, but it's something most people do, not because there are no jobs around, it's because you're a good person, because it's not easy. You have to have compassion, you have to understand humanity. So by being that, it's a great job, and with time, there are lots you can do. Because even while I was doing the health food practitioner course, most of the people I own were either nurses who are trying to cut down their hours because of the family commitments. They thought that's something they could go to in the meantime, be nurses at the same time. And others were retiring nurses or people worked in the medical sector. So it's all about caring for people. So the other things you could do that. You could go into nursing, or you could be a health practitioner like me, or with time open up your own company, help people. So caring for people is a good thing, and the beauty about it is at the end of the day, every day you feel like you've made a difference in somebody's life. and you go to bed a happy person because you've done
Lovely.
something good and
Lovely.
helped somebody.
That's the essence of it, isn't it?
Yeah.
And so with that, remember this: if you can see it, you can become it. So being a carer is not the end of it all. There's so many things you can do. At least Anabel is a living testimony of that coming to pass. Okay. So until I see you in my next video, always remember, never you forget that no matter what the matter is, you, my darlings, you matter so much more. Over.
Thank you.